Glad to be joined by Dr. Kenneth Sigman of Birmingham Gastroenterology Associates. Appreciate your time and being with us.
My pleasure. Thanks for having me.
And not only is that word hard for me to say, it's even harder for folks to understand. So let's start from there. Tell us what it is you do day in and day out on a daily basis.
Well, a gastroenterologist is somebody or a physician who diagnoses diseases of the intestinal tract, which would include the stomach, small intestine, and colon, but also is a specialist in areas of diseases of the liver, bile ducts, gallbladder, and pancreas.
Yeah, what a complex field, and like I said, could be intimidating to us, the layperson. It's impossible to be an expert at all those areas. Do you find that you have to specify on a couple in terms of expertise?
Well, I think you're right. The technology is so far advanced these days, and there's so much information out there that it's hard to be on the cutting edge and a real true specialist in all of those areas simultaneously. And so we do have specialties within the group. There are 14 of us in the group, and some are more specialized in liver disease. My area of specialty is in diseases of the gallbladder, bile ducts, and pancreas.
Okay, and tell us what in your office there are 14 physicians.
Yes, sir.
And so, kind of, what is a normal day like in those in the four walls there?
Well, it's really busy.
Yeah, I bet.
But we try and keep it organized, and we don't all see patients in the office on the same day so that it's not overwhelming. But we sit and talk to patients, and that's got to be the first thing, listening to what they have to tell us. There's so much of medicine that can be diagnosed just by listening to what patients' symptoms are.
And for our viewers, is the first step going to maybe the family doctor, or are there issues that if they kind of tell something's going on, they can go directly to you all?
Yes, and I think either way is appropriate. Sometimes patients feel more comfortable with going to their primary care physician and telling them what the symptoms are, and then that physician can refer the patient to us. But it's also fine, and we see people all the time who just call up the office saying, I have a specific a problem that I think falls within your area, and can I just come and see you? And that's perfectly fine as well.
How much has your practice and your field of specialty changed just in the last decade or so in terms of technological advances that will benefit the patient?
Well, a great deal. There's been so much advancement in the instruments that we use, especially the scopes, these flexible tubes with the light on the end of them that we can see inside the intestinal tract and get the images on the TV screen, that we can see so much more and treat so much more with less invasive procedures than we ever could before.
And that is good news for sure. If our viewers want more information about you all and what you do, how's the best way to get that info?
Well, we have a website that is easy to access and go through, and that's www.bgapc.com.
Okay.
Or the office phone number is 271-8000.
And we'll have that information on our website, daytimealabama.com. Doctor, thanks so much for being with us.
My pleasure. Thanks.
Dr. Sigman, great fella. He, as well as his practice and many others, are going to be at the Health Brothers coming up next week.
That's right, at Colonial Brooklyn Village Mall on October 5th, correct?
5th.
And also, Alabama Organ Center will be there. They're having a great concert tomorrow at the River Chase Galleria. We talk to them coming up next.